In Robert Frost's poem, The Death of a Hired Man, Mary and Warren sit on the back porch steps talking of their old hired man who this night returned to their farm in his last dying days, promising to work again. It's then that Warren speaks to the value of having a place to go. He says, home is the place where, when you have to go there, they have to take you in. The same goes for having a medical home. As a kid growing up in rural South Dakota, I knew my doctor. And for our family, he would give our immunizations, sew up our lacerations, treat our sore throats, help relieve our pain. He would even be there to support us when we were struck with impossible tragedy. His was a place where, when you had to go there, he would take you in and do his best to help. I didn't realize at the time how extremely valuable access to health care could be. Years later, in an Atlanta hospital, as an intern, I rotated onto the team that had to face vast waiting rooms of patients, some waiting more than 12 hours. I remember one fellow intern who bragged about seeing 45 patients in the less than 3 hours. It's hard to call that access when you get less than 4 minutes with a green intern for a medical problem that was trouble enough to cause you to wait that long. Still, many people in this country, especially those without insurance, have access to health care only through an extremely expensive emergency room somewhere. There they wait to see a complete stranger who must see them as a liability risk, and thus is encouraged to order every expensive test. However, in the end, the ER doc's hardest and most important job is to find somewhere or someone to take that patient in follow-up. And what's worse, too often there is no one to take the handoff, no medical home where the patient can go. Too many are medically homeless. I believe that in our society, every person should have a medical home. And until then, healthcare costs will continue to rise and quality will continue to be inadequate. So far in rural South Dakota, most of us still do have a medical home now. Oftentimes, however, a PA or a nurse practitioner and a doctor team. And we should realize that it is something of extraordinary value. After all, everyone needs a place that when we have to go there, they will take us in.